Welcome back to Straight Talk. I'm Laural Porter. We're talking about Providence's successful reduction of opioid use and how that's helping patients. Welcome once again to my guests, Providence patient Nancy Collins, Dr. Shorin Nemeth, and Dr. Jeremy Lynn. Once again, it's great to have you here.
Thank you.
Let's go back and talk about how a patient changes their brain to deal with pain differently. How does that work, Dr. Nemeth? Can that really happen?
It can. That's a great question, Laural. Thank you. So I describe it kind of in the context of, for instance, an Olympic swimmer. An Olympic swimmer is so well trained that they don't have to think about every single action that they do. When they swim in the water, it's fluid. Or a gymnast, for instance, you look at the gymnast on the floor and you say, I could do that, no problem, that's easy. And you go out and try it and you fail miserably because our bodies, our brains are not wired to do the things that they're doing. For them, these things are automatic. So our brains are trained to pay attention to things that are really important to us. That's its job, pay attention to things that are important to us. Here, I noticed this thing is bothering you. Let me show it to you and pay attention to it. Pain is one of those things the brain thinks is important because it's a danger signal. So after a while, the brain in chronic pain patients becomes an Olympic athlete in detecting pain. It is superior to nothing on this earth at detecting pain, and its sole purpose is to focus on pain. So retraining the brain means to untrain the brain from what it has been doing, e.g. focusing just on pain, and focus that brain on the things outside of pain, the other sensations one might feel in life or in their body.
So does meditation help with that?
Meditation can absolutely help with that. There are a number of things that can help with that. Education about this, we call mindfulness-based exercises or mindful movements. Those things can absolutely help. They've been shown time and time again in the literature to be very effective, even dating back to the 70s with Kabat-Zinn and his work. I think it was in the 70s or so. So absolutely, yeah.
Let me ask you about, we hear a lot about this because there have been all these lawsuits involving Purdue Pharma, and there's probably going to be more with pharmaceutical companies, with the role Big Pharma played in this opioid crisis. Dr. Lynn, what's your perception of that?
Yeah, I think there's a lot of blame to go around, and Big Pharma has a large share of that. But there's other folks that share some of that blame as well. There's regulatory bodies, physicians, I think, are somewhat involved as well. But I think when you have companies and governments pushing the use of pain medications, opioids, heavily, that's a problem. And I think that's really what triggered all of this. 20 years ago, physicians were being told, hey, look, there's this epidemic of untreated pain out there. We're going to ask patients how much of it they have, and your job as a doctor is to treat it with opioids. And if you don't, you're a bad doctor. And this was
a different attitude back then.
That was what we all heard. When I trained 20 years ago, that was the message, is it's out there, the patient's going to tell you what it is. They made it the fifth vital sign. So all the objectively measured vitals, heart rate, blood pressure, temperature, plus how much pain do you have. And we have to have all those look normal before the patient goes home.
Do you think all of these lawsuits, Purdue Pharma, it looks like there's going to be a $12 billion, it's a tentative settlement. All these lawsuits are going to have different results, that we're going to see the epidemic reverse itself?
I think we will. I think one benefit is the news cycle covering this so much. People are recognizing, hey, wait a second, these things are risky. It's just like what happened with cigarettes. There was all this advertising with Joe Camel to children. Cigarettes are great, and everyone loved them, and everybody smoked for a long time. But now, we'd look at that and laugh. And I think we'll be there at some point when we'll recognize that, hey, wait a second, maybe these things have some risk associated with them.
Nancy, you just celebrated your 75th birthday. Congratulations.
I did indeed.
We have a few photos to show you.
So proud of myself.
Well, you should be.
I am a survivor. Oh, my family.
These lovely pictures. Well, how are you feeling?
My son is so handsome. And my sister's so cute.
Well,
she's a lot smarter than I am, and I love her dearly.
You are opioid free?
I am.
How are you feeling about the future?
Free.
What message of hope would you like to give everyone?
I cannot begin to tell any chronic pain sufferer out there that there is incredible hope. It's just a choice. Do you want to stay as you are for the rest of your life? Because chances are you may not get any better. Or do you really want to be proactive and seek out the kind of pain care and management that you really deserved? The Providence Pain Management Program transformed my life in a relatively short period of time, 1 year.
How often do you go back to the clinic?
I go there at least twice a week. The follow-up is phenomenal. You don't just go to a 12-week pain education class, graduate, and get dropped. Every single week, all you have to do is make the commitment and show up. And I'm in mindful movement, which is my favorite class. I did Tai Chi for 6 months, and I was the worst ever, but it didn't matter to me. I thought I knew how to breathe. I did not. I learned new ways to breathe, to soothe myself, to greatly decrease my pain, and I gave up carbohydrates and sugar.
Well, you are a great example. Congratulations, belated
Thank you.
happy birthday, doctors. Nancy, thank you for joining us here on Straight Talk.
Thank
This is
you.
a topic that's so important. We hope that you'll come back. If you want to have more information, too, we have a website. The Oregon Health Authority has a website you can check out on news links. Also, we want to let you know that Straight Talk is now available on podcasts, wherever you download podcasts. Just look for KGW Straight Talk. Join us next week when my guests are Senator Wyden and former Senator Gordon Smith on the show together. We'll see you next week for Straight Talk.